The state is on the verge of a mental health crisis in the aftermath of Hurricane Ida.
Experts say it's a combination of being in survival mode, the lack of mental health resources, plus the trauma we've endured in the past. But as Candace Charles reports, it's not too late to do something about it.
People are just really mentally fatigued.
There are 365 days Hurricane Ida could have landed on. She appeared on the anniversary of Hurricane Katrina.
For a lot of people, it was extremely traumatic. We all know what happened. We almost lost the city.
Dr. Denise Shervington of the Institute of Women and Ethnic Studies started collecting data on public school children after Hurricane Katrina. The data showed Louisiana's children are 2 to 3 times more likely to have trauma-based conditions like PTSD, depression, and anxiety.
Similar to veterans coming back from war.
Inhale and exhale.
Dr. Shervington says things like dancing and yoga help to regulate our bodies and start to feel better.
You have the power to calm your body down.
Yoga instructor Valerie McMillan runs the Om Well in New Orleans. She says after Hurricane Ida, her client list grew.
Folks really need to de-stress everything that had been going on.
And unfortunately, that support is just not there.
If you survive and you have enough supports, then you will be able to get over the acute stress.
But the lack of accessible mental health care continues to plague Louisiana.
Our budgets reflect our moral compass.
And after a hurricane with private practices closed, mental health resources tend to dwindle. But there is a light at the end of this dark tunnel.
Breathing helps when we're in a very tense situations, to not hold our breath, to hold that in our shoulders and our gut. There's so much freedom in that.
Dr. Shervington says you don't necessarily need to see a doctor to manage the feelings that come up after trauma, but we need to acknowledge when traumatic events happen, things outside of us that make us feel overwhelmed, so we can manage those feelings.
It's okay. It's our body signaling that we need to pay attention to our immediate survival. And then the next step we need to take is figure out how we ourselves can manage.
Candace Charles, Eyewitness News.
Well, Dr. Shervington also says sleep and eating well are more important to mental health. For more mental health resources, you can go to our website, WWLTV.com.